All right, so today we're going to talk about vacuum erection devices, or VED, or penis pumps, not to be confused with an inflatable penile prosthesis, which is an implant. It is a pump, but it goes inside the body. This is different. This is a pump that we use outside the body to create erections. I'm Dr. James Kuan. I'm the creator of the Sex After Retirement newsletter. I'm a board-certified urologist, and I have 20 plus years experience in men's health, talking about topics just like this. My goal for you is information. Information so you understand where you are, what the problem is, and you can ask better questions to find better solutions when you're next with your primary doctor, your urologist, the sexual medicine specialist who sees you, the naturopath, whoever's taking good care for you. But all of that comes with the caveat. I am not your doctor. I'm a doctor, but I'm not your doctor. And so this is information. It is not a diagnosis. It is not a prescription. It is not an instruction to go do exactly what I've told you. It is to inform you, your partner, your relationship, and your next step. So, vacuum erection devices, what are they? We would probably say simply they are a penis pump. And what they are is they are essentially support, or they are a replacement for the failing mechanics or the failing plumbing of erections. So we've talked before about the dynamics and the things that have to happen for men to achieve a hard erection. We have to be in the mood. We have to stimulate, so we have to feel. The nerves need to be intact, and then those nerves need to signal the penis. The penis is a spongy tissue that's lined by vascular tissue. So getting an erection is getting in the mood, a neurologic, and then a vascular event. So when all of that flows, the blood flows, and it fills up that sponge. Think of those little toys you used to put in water, and you'd get a washcloth or a foam toy. When you fill the penis up with blood, it expands. As the penis expands, it gets harder. It may not get hard and it may not get firm. That's because as the penis fills, it has to trap its blood. There's a mechanism in the outer lining, the casing, let's say, of the erectile cylinders in the penis. There's 2 erectile cylinders. And as that fills up, those 2 layers that line the outer part of those cylinders seal and trap the blood. That's what makes an erection, or helps an erection go from hard to firm or rigid. That's the 25-year-old erection that a lot of you remember. So all of that has to happen. And as we've talked about before, there's many causes for breakdown of that system. But when that system is quote unquote not working, when pills have not worked, when shots have not worked, or you're not allowed to take pills because of a heart issue, or you're not allowed to use injections because you're on a blood thinner, or you're afraid of needles, enter the vacuum erection device or the penis pump. This pump takes the place of the pump and the hydraulic system of the penis. So, what is it? Well, it's a cylinder like this, and on the end, there's either a hand pump, or it's attached to a hand pump, or an electric pump. And what men do is they put the penis inside the cylinder when it's soft. You're using it maybe because you can't get an erection, but when the penis is soft, and when we pump, it takes air out and creates a vacuum. A vacuum being a space with negative pressure. And that vacuum then exerts pressure on that spongy tissue, pulling blood into the penis, allowing that vascular tissue to engorge and those erectile cylinders to become firm. That's how it works, and it stays that way as long as the vacuum is sealed, as long as that negative pressure is still exerting on the erectile tissue and the erectile cylinders, the penis will stay full of blood. So that's the mechanics And when you remove the penis or you remove the vacuum, things go back to normal, meaning there's no more pressure exerting outward, no more pressure pulling blood in, and the penis goes soft again. And so this is a way for us to fill the penis. And essentially, when we fill the penis, we are creating an erection. So instead of your heart and vasculature filling the penis, the external pump is doing the work. I talk about this because a lot of people have seen it, heard it, maybe on movies like Austin Powers, those types of things, and it's become something of a joke. And I can see how it's a joke. You know, if anyone's ever been to an adult store, they've seen them. If you know, you've seen Austin Powers, it's part of a joke. And it seems kind of awkward. It seems kind of foreign. And so for a lot of people, it's just a hard no. And for a lot of people who try it, it is a no, but they've tried it. And for a lot of people who try it, they're like, oh, this actually works. And so what I want to talk to you about are the various scenarios where a penile vacuum erection device could be helpful. And I'm going to tell you this one thing. Vacuum erection devices are not just for men who can't get erections. So listen, and we're going to talk about a few different scenarios. The first scenario we'll talk about, and I've already alluded to it, is that very typical scenario. We used to think of erection problems and treatment of them in a stepwise approach: pills, shots, and then vacuum device. And vacuum device often came before surgery. And so if we just talk about vacuum device as a tool for to get an erection, it's effective. 85 to 90% of men who use it will have an effective erection. That's not that bad, and it's probably more. All of that said, only about 50% of men who use it for erectile dysfunction are actually going to continue to use it. And so why is it that some people use it, and why is it that some people don't? Well, for some people, it's the only option. You know, the vacuum erection device is the only option for them that isn't surgery. Maybe they failed pills, maybe they've used injections, or maybe they just don't want an operation. Or as I said, because of medical conditions, they can't take certain medications, or they can't use the shot, or they've used the shot and they've had problems with an erection that lasted too long, or they didn't like how unreliable it was, meaning they had to do all this preparation. And sometimes the shot worked, and sometimes the shot worked too well. And so they could plan around it, but they couldn't rely on it working. They could plan around it, they could use it, but if the shot worked too well, then the erection didn't go away, and they were looking at their clock. It was 2, 3, 4 hours, and the penis was still hard. That may seem like something that men would aspire to, but that gets into medical emergency, urgency territory. And that can be scary if that has been your experience with penile injections. It can also be inconvenient because let's say you and your partner are used to having sexual activity in the morning, but you still work and you use a shot, but the shot lasts too long and it's like time to leave, but the erection's still hard. That's the downside of having an injection that's too effective. And so for a lot of men, they don't like the control that they don't have in terms of reliability, and they don't like the control that they don't have in terms of the erection going down. And so vacuum erection device is one solution. As I said, they put the penis into the cylinder when it's flaccid. The difference here, and I didn't explain this in the first description of the mechanism, is before putting the penis in, they're going to put a tight ring on the end of the cylinder so that after the penis has expanded and after the erection is created, they slide that ring back, trapping the blood in the penis. And there you have it. That's the erection. using the erection for intercourse or sexual activity is now available to that man and their partner. As I said, for half of people who try it, they will use this long term, and there's no potential damage. That's as long as you don't overinflate. I always tell people, inflate to stretch, not to pain. It also is helpful to not wear the ring for too long, trapping that blood. Think about, putting the string as a kid, around your finger. Eventually it gets cold and it gets blue. Just like if you squeeze your wrist for too long, your hand gets cold and it gets blue. So this is something we want to avoid. But usually using this for 20, 30, even 40 minutes is not going to be a problem. Now, what are the potential problems? The potential problem is that the penis is a little bit floppy. Half of the penis is inside the body, and the ring only goes at the base. And so we lose the rest of the foundation. And so it's an erection that you have to control. It's an erection that you have to guide because it may pivot where the ring is. The ring has to be pretty tight. Think about how much pressure has to be generated to create an erection. And so a tight ring is needed, and that can be uncomfortable. It can also be difficult to remove. And then the other thing is orgasm, ejaculation. If you still ejaculate, will feel obstructed. That ring is tight enough that semen's not going to flow through that. The other thing is that a partner sometimes might perceive the penis as being cool to the touch, not warm. And for most partners, that's not a problem. But for some, that is a change that they have to become accustomed to. And then the reality is some people just don't like the mechanical nature of it. And so that and those other reasons are why people may discontinue using the vacuum device. The next reason someone might use it is rehabilitation of the penis. And you're like, what do you mean by that? Rehabilitation shows up in two places in erectile dysfunction. And it shows up in the guy who is maybe having some early decline in erections, maybe still responding to pills. And it also shows up, to use a rehabilitation approach after prostate cancer surgery. And so in both of those scenarios, the vacuum erection device is used to either maintain and maybe even restore some vascular function to the penis. We've already covered that getting an erection is a vascular event. You've heard me talk before that there's age-related changes that I call the march of life. That march of life is hardening of the arteries. And you've also heard that there's a use it or lose it phenomenon. If you are continually impotent without getting good erections, what's happening is you're developing atrophy or contraction or limitation in the penis. Blood vessels are healthier when they stretch and expand and then relax. Stretch and expand and then relax. A normal, healthy vascular system does that. We get erections at nighttime, we get spontaneous erections with arousal throughout the day, and that is healthy for the penis. That stretch and expand. Think of it like calisthenics. The more we stretch, the more yoga we do, the more laxity, the more limber, the more extensible we are. That in the penis is a marker of good erectile function. So you take that young guy who's starting to notice some of the changes of aging, mild erectile dysfunction. You've heard me say before that the penile blood vessels are smaller than those in the heart. And so erectile dysfunction in the penis is like the canary in the coal mine. When people are having erectile issues, it can predict the onset of heart disease and vascular disease. And so you take that guy with mild erection problems and he says, hey, I want to make sure that I'm doing everything that I can to prevent or at least slow further decline in my erectile function. That guy may opt to use a vacuum erection device. because how can we recreate stretch and relax, stretch and relax by repeatedly inflating, hold, and deflate. Inflate, hold, deflate, rinse and repeat, rinse and repeat. I generally recommend for this scenario 10 to 15 minutes, each with a cycle. Inflate, hold for 30 to 45 seconds, and deflate, rinse and repeat, 10 to 15 minutes. At least 3 or 4 times a week or daily if someone's motivated. And so in that guy, it's keeping those blood vessels limber so that he can potentially avoid a more rapid decline related to age and hardening of the arteries in his penile vasculature, which, if he left it untouched, may actually result in him requiring higher doses of pills or shots or surgery, or using the vacuum device for erections as we described. Another scenario is the guy who had his prostate removed. When we remove the prostate, attempts to spare nerves are made if it makes sense that sparing nerves doesn't leave cancer behind. And so in men who have prostate surgery, they are faced with the potential for lifelong erectile dysfunction if both nerves have to be removed, or temporary erectile dysfunction until their erections return after they've healed from surgery, or maybe even only partial recovery. And so what do? Well, there's this period of time where likely nothing is going to happen, even if one or both nerves are spared, and the penis sits dormant. We've already said that when a penis doesn't stretch and expand, you can get contraction, or what we call atrophy. Atrophy is essentially a hardening and a loss of the extensibility of the penis. And when you lose that extensibility, you may lose the vascular function. And so even if you've spared the nerves, but do nothing, there is a chance that there may either be delay or only partial response. That's not to say that using a vacuum pump in that 10 to 15 minutes, inflate, hold, deflate, inflate, hold, deflate, is going to guarantee that erections will come back even when nerves are spared. But what it's going to do is keep the tissues healthier so that if and when the nerves begin to function again, the penile tissues are going to respond sooner and may be better because of the work and the time that guy took using the vacuum device to keep the blood vessels functioning when spontaneous function wasn't there. And so for rehabilitation, just to recap, 10 to 15 minutes, 3 to 4 times a week or daily, inflating till you feel stretch, not pain, hold for 30 to 45 seconds, deflate, rinse and repeat for 10 to 15 minutes. Here's another scenario where a vacuum pump may actually be helpful, and it's for the guy who is anticipating having a penile implant. We've already talked about the use it or lose it, and so in that, there's also a shortening. When you get atrophy, you get shortening of the shaft of the penis. And so if you consider the typical person, maybe that's you, who has gone through all the stages of erectile dysfunction, and now you're considering a penile implant, you've maybe gone years without reliable erections, or only having erections on demand when you took a pill, or when you did a shot, or when you used the vacuum pump. And so in between those erections, there weren't those nighttime erections that caused the tissue to expand. In between those erections, there weren't the spontaneous daytime erections, the partial erections. And just like when we sit and don't exercise, we get restricted. And so that same thing happens to the penis. One of the things we talk about specifically in men considering penile implant is size. Nobody wants to lose length. That said, your penis has already shortened before you go on to have a penile implant. So we're always going to give you as much implant as we can fit. But what we can fit today is not what we could have fit when you were 25, when the penis was healthy, when age-related vascular changes hadn't shortened the penis, when all of the years of lack of spontaneous function didn't stretch the penis. That is what we get at 60 or 65, is we get an overall shortened penis. We will implant what we can, but it's shorter than when you were 25. So this is another scenario where we recommend using a vacuum device. We recommend using it as described for the guy who wants to rehabilitate the penis after prostate surgery, or the young guy that wants to help maintain or slow decline in function. 10 to 15 minutes a day, 3 to 4 times a week, or even daily for 6 to 12 weeks leading up to the penile implant. Inflate, hold, deflate. Inflate, hold, deflate. That brings back some of the memory in the tissue. And what we find is that we can probably get 1 to 2 centimeters or up to half an inch restored in men who have had shortening. Not in all men, but that's the potential. It's a choice to do it. And what I do for men prior to penile implant surgery is I stand them up. And when I'm doing the exam to make sure that there's no problems that we should anticipate before surgery, I pinch the head of the penis and I pull and I say, look down. That's as big as your penis is going to look with the implant in place. And most guys say, that's not what it looked like before. And I say, that's not what it looked like before you developed erectile dysfunction. And so if he's unhappy with that length, and if he wants to improve that length, it's his job to do the work before surgery to prepare the tissue as much as it can, because I'm always going to put as much implant as I can fit within good surgical technique and reason. And so if he doesn't, it may be 1 or 2 centimeters less than if he does. Again, there's no guarantee, but in terms of optimization, this is really the tool that we have available to us. And it works. And most guys will actually say that they felt the change, leading up to surgery as they progressively use the vacuum pump. There's 2 other scenarios. One is the person who maybe used shots, who then developed an erection that lasted too long, putting him at risk for scarring and fibrosis in the penis after what is called a priapism. So when you fill the penis up and you trap the blood there, the pressure in the penis gets so high that you're not actually getting fresh oxygenated blood. That's okay for a while, but if it goes beyond 4, 6, 8 hours, those tissues are screaming for oxygen. It's painful, and lots of those guys are really uncomfortable. Fortunately, with careful, dosing, that doesn't happen that often. But when that tissue has been starved of oxygen, what happens if we leave that tissue untreated, let's say, is that it eventually will scar and build restriction in the shaft of the penis. And so another scenario where I ask men to use a vacuum pump is after we take care of that prolonged erection for at least 3 to 6 months after, to help prevent restriction that can come as a result of that erection lasting too long. And then the final scenario where I think a vacuum pump might be helpful, even if you don't have erectile dysfunction, is if you have a condition called Peyronie's disease. Peyronie's disease is often described as the bent carrot, or not the curve that you were born with or that you developed in puberty, but you normally had a penis like this and now it's bent. The vacuum device is probably less effective for bend, but some men with that condition also develop a waist or a narrowing, or what we call an hourglass defect. It's an indent in the shaft of the penis, because what's happened is the walls of the penis have been pulled in. So you can imagine if you take a vacuum pump, it has the potential to pull them out, filling that area up, and maybe helping them restore some of the girth loss. All of this is to say there are several scenarios where men can use a vacuum pump. They can use it to get an erection because the other things they've used haven't worked or they aren't allowed to take them for medical reasons. They can use it to potentially slow down the progression of age-related erectile dysfunction. They can use it to help maintain function after something like prostate surgery. They can use it to help restore some length in anticipation of a penile implant to overcome the shortening that's happened because of years of erectile dysfunction. They can use it to help recover from a condition like priapism or a prolonged erection as a result of, say, medical issues or medications. Or they can use it to help the indentation that's often associated with a bend in the penis in a condition called Peyronie's disease. And so there's lots of uses for this device. And I've already discussed the protocol. I want to talk about just a couple other sort of housekeeping things that help with using this device. This device is awkward. It's an external pump, but when used with an open mind, maybe a little humor, a little trial and error, it can be very effective for men who want to use it. So keeping an open mind is important. Clipping the hairs at the base of the penis is important. If hairs get into the cylinder, it breaks the vacuum, and so the pump isn't going to work as well. So clipping the hairs at the base of the penis, using lubrication on the shaft of the penis helps create a better seal between the skin and the cylinder, and then also protecting the testicles from getting sucked up. You heard me. If you don't keep the testicles down, they may get sucked up. That's a pretty uncomfortable solution, and that's probably going to break the mood. And so those are a few of the things that you can do to also help use this differently. There's lots of places to buy them. I mentioned at the start the adult store. I tend to recommend that people get a medical grade one. There's a number of suppliers of them. Medical grade ones are going to probably be safer. They're going to have more uniform pressure. They might be a little bit more expensive. I tend to take the approach I take with electronics here. Don't buy the cheapest, don't buy the most expensive, buy something in the mid-range, but buy real technology. So buy something medical. And I tend to tell people, if you're using a shared Amazon account, don't buy it, because you may have to explain at Thanksgiving what it was that you bought to someone in your family. So often going to a medical supply company, and your urologist or your sexual medicine doc can point you in the right direction for something like that. Treating sexual medicine is about keeping an open mind to all of the options, not just understanding the causes, not just knowing the options, but keeping an open mind to actually try these options. A lot of men will try it and not use it, but a lot of men will try it, be surprised with how it works for erectile dysfunction. And then we talked about these scenarios where a lot of men will use them temporarily to help prevent or to eliminate or minimize potential future problems, or to prepare for penile implant surgery. I want you to drop some questions in the comments or send us an email if you have questions, because I know that this is new to a lot of people. It's more than a joke. It's a real solution for a lot of guys. It helps if you follow us. It helps us if you share this with someone else. It helps us if you like or comment. So I consider doing that. And as always, you can sign up for my newsletter, www.sexafterretirement.com. I'm Dr. James Kuan. Thank you for listening.